arthritis. Okay, so we'll go into the next topic called as arthritis. See, arthritis means, what is called as arthritis? Arthritis is inflammation of joint is called as an arthritis. Inflammation of joint is called as an arthritis. Arthritis means inflammation of joint is called as an arthritis. This arthritis can occur because of two basic entities. One is because of degeneration. As you grow older, your joint will degenerate, resulting in degenerative arthritis. Or because of inflammation, you can get arthritis. Because of inflammation, you can get arthritis. Or because of infection, you can get arthritis. Or because of infection, you get arthritis. So arthritis can occur because of degeneration, because of inflammation, or it can occur because of infection. The example for degenerative arthritis is osteoarthritis. Example for degenerative arthritis is osteoarthritis. Inflammatory arthritis are classified into two broad categories. If the patient has got rheumatoid factor positive, he is called as seropositive arthritis. He has got seropositive arthritis. He has got seropositive arthritis. If his rheumatoid factor is negative, then this condition is called a seronegative arthritis. Example for seropositive arthritis is rheumatoid arthritis. And example for seronegative arthritis is ankylosing spondylitis. Psoriatic arthritis. Reactive arthritis. Reiter's syndrome. Enteropathic arthritis. Okay, so there are a lot of examples for that. See, very simple. I'm not going into larger details of arthritis. Just understand this. Arthritis means it is the inflammation of joint. So that inflammation of joint can occur because of many reasons. One, it can occur because of degeneration. As you grow older, the cartilage degenerates, so arthritis happens. That is called as osteoarthritis. Whereas inflammation can occur, and because of inflammation, an arthritis can occur. Those are called as inflammatory arthritis, and we classify that broadly into two. You test the patient for rheumatoid factor. If rheumatoid factor is positive, that is called as seropositive arthritis. If rheumatoid factor is negative, then he has got seronegative arthritis. The examples you are seeing here. Infection we have already seen in the previous classes, so I'm not going into details of that. We'll in the hip region we'll again see specific infection and related to it, and the arthritis related to it. Now we'll start with osteoarthritis. Common in elderly people, common in females, common in obese patients. Joint most commonly involved is knee joint. Because when you stand, weight goes to the knee joint. So because of that, knee joint gets degenerated early. So osteoarthritis is more common in knee joint, and that too on the medial side of the knee joint degeneration is more. Resulting in a deformity called as varus deformity, which is called as genu varum. So genu varum deformity is common in osteoarthritis of knee. Very, very important point. Genu varum deformity is common in osteoarthritis of knee. Once if you diagnose the patient with osteoarthritis, you can classify them under two categories: localized or generalized. If more than 3 joints are involved, then it is called as a generalized osteoarthritis. If less than 3 joints are involved, we call it as a localized. One joint or 2 joint alone is involved, it is called as a localized osteoarthritis. If it involves more than 3 joints, it is called as a generalized osteoarthritis. Other joints which are commonly involved in hand are distal interphalangeal joint, proximal interphalangeal joint, and first carpo-metacarpal joint. Involvement of distal interphalangeal joint results in swelling in the distal interphalangeal joint, which is called as Herberdon's node. Involvement of proximal interphalangeal joint will cause swelling in the proximal interphalangeal joint, which is called as Bouchard's node. Once you diagnose a patient with osteoarthritis, how are you going to treat him? You treat him with rest, you give him analgesics to reduce the pain, and you give physiotherapy for strengthening the muscles. If the deformity is very severe, you can treat it by arthroplasty. So you can give rest, analgesics, physiotherapy. You can even give steroid injections. If the problem is not rectified, you can replace the joint by a technique called as arthroplasty. Arthroplasty is a replacement of the joints. Now you take X-ray of the patient with osteoarthritis knee. The following findings you will see. The 4 findings is: one is joint space narrowing. Because of the loss of cartilage, the joint space gets narrowed. There will be subchondral sclerosis. There will be subchondral cyst. And there will be osteophyte formation. So these 4 findings you will get if a patient has got OA knee. And these are the 4. Not only in OA knee, even in OA hip, you will have similar findings. So whenever a patient has got osteoarthritis, when you take X-ray, these findings you will see in an X-ray. Okay, I'll just draw a picture to show you how this will look like. So this is knee joint. This is tibia. So you can see the joint space getting narrowed on the medial side. This is medial side and lateral side. The bone will get thickened. This is called a subchondral sclerosis. You will have cyst here. These are called a subchondral cyst. And you will have bone formation here called as osteophytes. So this kind of picture you will get in an X-ray of osteoarthritis. Okay. So this is how you diagnose and you treat the patient with osteoarthritis. Now coming to the next arthritis called rheumatoid arthritis. What happens in rheumatoid arthritis? Rheumatoid arthritis, as I already told you, it is an inflammatory arthritis. Because of inflammation, arthritis occurs. That is why rheumatoid arthritis comes under inflammatory arthritis. Rheumatoid arthritis most commonly occurs in females. Whenever inflammation occurs, this inflammation affects the synovium. Synovium is around the joints. So when synovium gets affected, the blood vessels in the synovium proliferates. And it results in formation of a structure called as pannus. And this pannus resulting in arthritis. Okay, resulting in arthritis. So very, very important point in rheumatoid arthritis. Rheumatoid arthritis occurs because of inflammation. It causes pannus formation, which causes erosion of bones and cartilage. Which causes erosion of bones and cartilage. So very important point is pannus formation is very important in rheumatoid arthritis. When you do blood investigation for rheumatoid arthritis, you can see the ESR being elevated. So blood investigations, when you do, since it is an inflammation, there is inflammation process going on in the body, the inflammatory parameters will be elevated. So ESR will be elevated, CRP will be elevated. The patient will have rheumatoid factor positive, and you will also have anti-CCP positive. Anti-CCP positive. You will also have anti-CCP positive. When you take X-ray of the patient with rheumatoid arthritis, there will be uniform joint space narrowing. There will be uniform joint space narrowing. There will be uniform joint space narrowing. This is the joint which is affected by rheumatoid arthritis. Okay, this is the joint affected by rheumatoid arthritis. And this is the joint affected by osteoarthritis. What is the difference between these two? Here the joint space is more, here the joint space is reduced, but here joint space is equally reduced on both the sides. Okay. So in rheumatoid arthritis, there will be uniform joint space narrowing. There will be marginal erosions. There will be marginal erosions. There will be genu valgum deformity. Genu valgum deformity. There will be genu valgum deformity. So these are the features which are seen in an X-ray. Once you diagnose the patient with rheumatoid arthritis, how you treat the patient? You treat the patient with drugs like DMARDs. What are called as DMARDs? Disease modifying anti-rheumatoid drugs. Disease modifying anti-rheumatoid drugs. Examples are methotrexate. Examples are methotrexate. Examples are HCQs. Examples are sulfasalazilins. So based on these drugs, you can treat the condition. You can even use monoclonal antibodies like infliximab or anakinra to treat this condition. So these are monoclonal antibodies. Monoclonal antibodies. Pharmacology over? No. Okay. So they will teach all these things when they teach pharmacology. So these are monoclonal antibodies which can be used to treat rheumatoid arthritis. If the condition is still worsened, if the patient lands up in deformity, then the patient can get arthroplasty. Patient can get arthroplasty. Now, what is the difference between ONE or osteoarthritis and rheumatoid arthritis? Okay, we'll just see the differences alone. Here, this is an degenerative arthritis. And here it is an inflammatory arthritis. The most common joint affected is knee joint. Most common joint affected is knee joint. The most common joint affected in rheumatoid arthritis is metacarpophalangeal joint, proximal interphalangeal joint, and wrist joint. These are the joints which are most commonly affected in rheumatoid arthritis. Okay, in rheumatoid arthritis, metacarpophalangeal joint, proximal interphalangeal joint, and wrist joints are most commonly affected. Whereas in osteoarthritis, knee joint is the one which is most commonly affected. Here there will be uniform joints, here there will be medial joint space narrowing. Medial joint space narrowing. Here there is uniform joint space narrowing. Uniform joint space narrowing. Osteophytes are seen in osteoarthritis. Osteophytes are seen in osteoarthritis. Osteophytes are absent in rheumatoid arthritis. Osteophytes are absent in rheumatoid arthritis. Okay, so these are few differences and things about rheumatoid arthritis and osteoarthritis. Now we'll go to the next part of arthritis and we'll see one important seronegative arthritis. One important seronegative arthritis, that is ankylosing spondylitis. Ankylosing spondylitis. Ankylosing spondylitis. Now what is called as ankylosing spondylitis? In ankylosing spondylitis, a condition called as enthesitis occurs. What is called as enthesitis? If you take a bone, the bone is attached to the muscles. The bone is attached to the muscles by means of tendons or aponeurosis, or it can get attached by means of ligaments, or can get attached by ligaments. So inflammation in these areas is called as enthesitis. So inflammation at the site of ligament attachments or tendon attachments is called as enthesitis. Enthesitis. So ankylosing spondylitis is an example for enthesitis. It causes inflammation at the site where the ligaments are attached or tendons are attached. Ankylosing spondylitis mainly affects the axial skeleton. Mainly affects the axial skeleton. Do you know what is called as axial skeleton? Axial skeleton, what is called as axial skeleton? The bones which lies in the center of your body belongs to axial skeleton. What are the bones which are lying in the center of your body in the back? What is this? Vertebra. What are the bones that is lying in the center of the body anteriorly? Sternum and ribs. So skull, vertebra, ribs and the sternum are called as axial skeleton. The bones which are present in your limbs are called as peripheral skeleton. Okay. So axial skeleton is commonly involved in ankylosing spondylitis, whereas in rheumatoid arthritis and osteoarthritis, peripheral skeleton is most commonly involved. So involvement of axial skeleton results in a classical finding called as sacroiliitis. So sacroiliitis is diagnostic of ankylosing spondylitis. So sacroiliitis is diagnostic of ankylosing spondylitis. Very, very important. Sacroiliitis can be early picked up by MRI. You can even see sacroiliitis in X-ray, where there will be haziness of SI joint is noted, and sclerosis is also noted in the SI joint. So based on X-ray and MRI you can diagnose, but MRI is the most reliable investigation to diagnose sacroiliitis at the earliest. At the earliest, sacroiliitis can be picked up by MRI. These patients will have HLA-B27 positive. These patients will have HLA-B27 positive. These patients will have HLA-B27 positive. So normally when you take the spine will be like this. This is the spine of a normal person. This is the spine of a normal person. Okay, the anterior or vertebral body, the posterior or the spinous process, and you get the intervertebral disc here, and you get a ligament here. What is this ligament called as? Can anyone tell me the name of this ligament? This is called as anterior longitudinal ligament. This is called as posterior longitudinal ligament. Now, what is called as enthesitis? What is called as enthesitis? Inflammation of the ligaments or the tendons where they are attached to the bone. Now, because of inflammation in these ligaments, bone formation occurs here. Bone formation occurs here in all this area. So the spine gets fused with one another. So spine gets fused with one another. Just imagine when the spine gets fused, will you be able to bend or will you not be able to bend? Yes, these patients will have difficulty in bending forward because of the fusion of the spine. And when you take an X-ray, the spine will appear like a rectangle. The spine will appear like a rectangle. This is called as bamboo stick appearance. This is called as bamboo stick appearance. This is called as bamboo stick appearance. So bamboo stick appearance of spine is diagnostic of ankylosing spondylitis. Is diagnostic of ankylosing spondylitis. There is another kind of spine called as rugger jersey spine. Rugger jersey spine, which is seen in renal osteodystrophy. It is seen in renal osteodystrophy. It is seen in renal osteodystrophy. Rugger jersey spine is seen in renal osteodystrophy. Okay. So when the patient is affected by ankylosing spondylitis, movement of the spine gets restricted. Movement of spine gets restricted. The patient will have difficulty in chest expansion. So chest expansion is reduced. Difficulty in chest expansion because ribs are also part of axial skeleton, which is getting involved. Because of the chest expansion is decreased. Normally, the patient should have 5 centimeters of chest expansion. If it is less than this, then it indicates that the chest expansion is restricted. So the patient will have movement restriction in the spine. The patient will have difficulty in chest expansion. The patient will have difficulty in chest expansion. The movement of the spine restriction, the restricted movements can be diagnosed by a test called a Schober's test. By a test called a Schober's test. Sacroiliitis can be diagnosed by a test called as figure of 4 test. Figure of 4 test or pump handle test. Sacroiliitis can be diagnosed by figure of 4 test or pump handle test. Or it can also be diagnosed by a test called Ganselen's test. Ganselen's test. So these are various tests to diagnose sacroiliitis. Schober's test is used to diagnose the movement of the spine, movement restriction in the spine. Movement restriction in the spine is diagnosed by Schober's test. These are the various tests that are used in diagnosing ankylosing spondylitis. Ankylosing spondylitis, okay? So how you treat this condition? This is very difficult to treat. You can give him only physiotherapy. You can give him physiotherapy. If the deformity is too much, if it is cosmetically and functionally affecting, then the patient can get deformity correction. Deformity can be corrected if it is too much disturbing. Okay, so this is about ankylosing spondylitis. Very important point is it affects the axial skeleton and it causes sacroiliitis. It causes sacroiliitis. In these patients, HLA-B27 will be positive. HLA-B27 will be positive. And when you take an X-ray of this patient, the spine will look like a bamboo. So it is called as bamboo stick appearance. So these are the tests to diagnose ankylosing spondylitis and how you treat it. Okay. So this is about the arthritis of limbs. Only few add-on points I'll tell you. In psoriatic arthritis, MCQ related point alone, the patient will have sausage digits. Okay, so the psoriatic arthritis most commonly affects distal interphalangeal joint. If you take, this is the middle phalanx, this is the proximal phalanx, and this is the distal phalanx. This joint is called as distal interphalangeal joint. This joint is called as proximal interphalangeal joint. Distal interphalangeal joint is most commonly affected in psoriatic arthritis. So it results in a deformity like this. So this will be the distal phalanx, this will be the middle phalanx, this will be the distal interphalangeal joint which has got destroyed. This is called as pencil in cup deformity. Pencil in cup deformity. You can see the middle phalanx is sitting like a pencil in a cup. So this is called as penicillin cup deformity, which are noted in psoriatic arthritis, I hope you know a condition called as psoriasis, which affects the skin. So that condition can affect the joints also. So that is called as psoriatic arthritis. The common features which is saw in psoriatic arthritis are sausage digits and penicillin cup deformity. The destruction can be very severe. It can result in arthritis mutilans. Okay. Then there is a condition called as Reiter syndrome. Reiter syndrome is a triad of urethritis, conjunctivitis, and arthritis. So Reiter syndrome is combination of urethritis, conjunctivitis, and arthritis. Occurs in streptococcal infection. Reactive arthritis occurs in chlamydia infection. Or Shigella infection. These are commonly agents causing urinary tract infection. When they cause urinary tract infection, it can also cause arthritis of the joint. These joints are called as reactive arthritis. So reactive arthritis, you should remember this bacteria alone, chlamydia or Shigella, which causes reactive arthritis. So this is about the arthritis of the joints. So arthritis simply means it is inflammation of the joint. Okay. So with this, we are done with arthritis. And the next topic is metabolic bone disorders. That will start after lunch. Before that, we'll discuss few questions from the yesterday topics.